Hi, Dr. Centeno here. We're going to show you the multi-cortical site draw. Now, the patient's been very well numbed prior to this with a field block of the skin, the soft tissue, the periosteum throughout the entire area under fluoroscopy. And then we're going to show you how this multi-cortical site draw is performed. So I've numbed up the top of the PSIS that you can see on the screen there. And now we're going to get started. Stacy, is that painful?
No.
Okay. So we're going to pick the first cortical site here. Going to do some pre-heparinization of that cortical site. And we'll do a couple cc draw here in the same 10 cc syringe. Now we're going to go a little bit 1 centimeter in depth and redo our draw. A couple cc's. You can. I've also done this up to 5 cc's per actual site. So I put a 10 cc draw at that site. I'm doing a lower volume here in an attempt to replicate the Marrow Cellutions system, which does a lower volume draw. But you could go up to 5 cc's. So I'm putting in a little pre-heparinization of the second cortical site. I'm going to take a few cc's here, and about 2.5 per is what I'm doing. And I'm going to go 1 centimeter at that cortical site. One centimeter deeper at that cortical site. I don't need any more pre-heparinization. I'll fill this up now to the full 10. And send this down to the lab for processing. Now we're going to go to another cortical site. So that's 2 cortical sites so far. This is now moving on to the third cortical site. Just through the cortex, a little bit of pre-heparinization at that cortical site. We have one that has heparin in it. So that's 10,000 units of heparin in 1 cc. I'm going to draw a couple cc's here. And I'm going to go a little bit deeper at that cortical site. Just 1 centimeter. Draw another few cc's. And I'm just going to repeat this until I get the volume I need. In this case, I'm going for 30 cc's on this side. So you can see that's basically how this is done. It's not a difficult procedure to do. 10 cc syringes, a couple cc's per site just below the cortex, then 1 centimeter deeper, and then another couple cc's. Pre-heparinize that cortical site just once.